Hello, and welcome back to ACT Program Webinars for Healthcare Professionals. I'm Robin Geiger, SVP of Clinician Advocacy for Ingenovis Health. And today I'm excited to host an expert from Mayo Clinic to guide us through a discussion on strategies to prevent stress and coping mechanisms to get us through some stressful times. Patrick Decker-Tonnesen, Ph.D., M.S.W, pronouns he, him, is an equity, inclusion, and diversity advisor at Mayo Clinic. He holds a doctorate in social work from Loyola University, Chicago, and his substantive area focuses on the experiences of individuals who have historically marginalized identities. He also holds a Bachelor of Science in Psychology from Mount St. Mary's University and a Master of Social Work, as well as certificates in nonprofit management and philanthropy and measurement and quantitative methods from Loyola University, Chicago. So join me in welcoming Dr. Decker-Tonnesen.
Thanks so much, Robin.
Thank you so much for being here. And I'm just going to make sure that you can share your slides.
Yes.
And you can get started.
Awesome. Thank you so much. Again, it is wonderful to be here today with you all. And thank you for that kind introduction, Robin. I had the privilege of presenting before at this series, so it's great to be back. As Robin mentioned, I'm an equity, inclusion, and diversity advisor at Mayo Clinic. And a lot of my research and my background is highly in the realm of well-being and belonging. So I think we're in for a robust conversation. And throughout this, I welcome your interactions. So feel free to express those however is most comfortable for you. We'd love to hear from you. Yeah, I'll get us kind of kicked off. And just to start, I want to briefly talk about what our objectives are. So my guess is you are here because you might be like me, and that might be that you are navigating high levels of stress and burnout constantly in your professional and or personal lives. So we're going to kind of tackle that head on by looking at some of the recent trends and factors that are impacting stress and burnout in healthcare workers. I'm also going to talk about some stress management techniques that can enhance your personal and professional well-being. And finally, I'll close us out with looking at some burnout mitigation strategies that hopefully you can utilize and will help you to promote your own well-being and belonging. So as we get started, I'm going to ask all of you to engage with me in a mindful minute. This is a practice that is, for many, very, very comfortable, something you're probably quite used to. And for others, this might be something that you don't do very often. I can tell you myself, I don't do this as much as I would like, but it's a pretty powerful practice. So just for the next 60 seconds, I'm going to ask all of us to just take a minute and breathe. You can close your eyes if you'd like, but really just take a moment and allow yourself to just be present in the space you're currently in. And after 60 seconds is up, I will invite you back into the space. So you might not believe it, but that was a full 60 seconds. I think for some of you, that was probably way too short of a mindful minute, but for others, it might have been actually a little long. The practice of mindful meditation is something that goes back hundreds and hundreds of years, and it's a practice that really is ingrained in and I think this is so cool about it. A lot of ancient and religious practices. Uh, if you kind of do a history analysis of ancient cultures, and again, particularly looking at religious circles, they really used mindful minutes as a way to, or excuse me, mindfulness as a way to engage with understanding themselves better. And it's a practice that we've slowly integrated back throughout time in different ways in our lives. But even taking 60 seconds, it does incredible, it has incredible benefits for your mind and your body and your soul. So I thank you for participating in that with me. Uh, Jumping right into the content of our conversation. So I hope you enjoyed that quiet peacefulness, because we're going to start out talking today about the trends and the factors impacting stress and burnout in healthcare today. The image I have on the screen for you all is not something that is going to be shocking for you to see. I'm sure if you're like me, back when the COVID pandemic was first beginning, you were constantly refreshing your browser to see where the virus was most prominent. And then in this particular image, you can see there came a time when it was really hard to even differentiate where it was most impactful, because in the United States, as an example, we were well beyond capacity in navigating the pandemic. And the reason that I wanted to start with bringing the pandemic up is because there has been a huge increase in the number of research, studies, publications about the specific topic of stress and burnout in healthcare since the pandemic started. If you look at a diagram of the number of publications that were occurring before the pandemic to afterwards, you'll see a substantial increase in the interest in this topic. So I wanted to bring that up, not because it's surprising, because I'm sure many of you are aware of that, but because it really has allowed us as a healthcare field to understand that we, as oftentimes frontline staff who are seeing patients, who are navigating the healthcare system, really need to be tuning into our own mental, physical, spiritual well-being. And that is not something that we are very good at naturally, or something that we were really doing before the pandemic. But again, fortunately, that awareness around stress and burnout has increased quite substantially. Still, and this is a very important asterisk to that discussion, is that mental health stigma runs rampant in the healthcare profession. And there are many reasons for this. And throughout this presentation, I'm going to be pulling in lots of different tidbits of research. So research both showing why these factors are occurring, and then research showing what you can do in your role as a healthcare provider to mitigate and even overcome some of these stigmas and barriers. The top reasons, though, I will share as we get started for the persistent mental health stigma we see in the healthcare profession have to do with a lot of the experiences that we have as healthcare workers in our day-to-day life. So overcapacity, feeling under-resourced, the concept of caregiver persona, which really means at the end of the day that we need to be 100% fully present for the patients that we're seeing in front of us. So we often don't actually take the care we need for ourselves. And then feelings of being undervalued, which is unfortunately quite pervasive for folks who work in the healthcare profession. And we know that staff who feel undervalued have less belonging, they have decreased well-being, and they also have lower self-esteem. So the combination of these is really a negative factor that has a strong correlation with your mental health status, and also the general levels of stress and burnout you experience on a day-to-day basis. So looking a little more specifically into some of these concepts, I want to unpack 5 areas of stress and burnout factors that are impacting healthcare professionals today. My guess is that all of you listening in are going to be quite familiar with these. These aren't going to be shocking to you. However, I think the value of going through these is that we can see collectively how we as a profession are kind of feeling right now. If we do, if we were to do a pulse check on our healthcare profession, this is the current data. This is how we are as a population are feeling. And then after going through these, I'll spend a good amount of time actually getting into the mitigation strategies and the ways that you can kind of tackle these things. So the first one you can see here, this is probably the most popular and well-known burnout and stress factor that influences everyone, regardless of your profession or what sector you work in. And work-life imbalance, as I like to call it, is really that struggle, that constant tension that we have navigating our home or our personal lives and our professional lives. I know, particularly within the healthcare field, this line becomes incredibly blurred. I like to tell people that the only things I will wake up for in the middle of the night are family or work-related issues. And I think that's true for most people. If you, at the kind of the crux of our lives, if we think about it, if we were to look at the scale of our lives, we spend a huge majority of our time at work. And what that means is that work becomes an integrated part of our beings. And if we're thinking about ourselves as multifaceted human beings, so people who are, we have our mental cognitions, we have our physical abilities, we have our beliefs, our values, all these different components that make us who we are as humans. Work is actually a huge component of that because we just, as a baseline, spend so much time doing it. And some of the ways that this shows up in different people's lives is, and I know we all fall trapped to this, but when you are at home in particular, so when you're technically off the clock, you're thinking about work. A lot of times you're actually working. You're looking at your emails, or you're thinking about a client interaction you had, or you're thinking about all the things that you were supposed to do that you didn't have time to get to. And over time, we know this by looking at the brain, the more time we start to spend thinking about work outside of work, the more natural it actually becomes. So for a lot of people, this work-life imbalance actually isn't as pronounced as it has historically been, because we as a society have actually become so accustomed to having work and life so interconnected that the gray area between these places has really almost ceased to exist. And I'm sharing a lot of these details, which I know, again, I know some of this isn't going to be revolutionary to you, but I think what will be helpful is when we start looking at our mitigation strategies. The next thing we're going to look at is the prevalence of heavy workload. And I think a great way to capture this, and I am a perfect example of someone who I think the person I'm married to after my spouse are Post-it notes. And it's because I use them so much and they really do help me remember a lot. But just going back to this image really quick, they also become fully consuming. If you think about, so your thing might not be sticky notes, you might have other things. I know a lot of people actually use electronic sticky notes, or people, of course, carry journals or notebooks. You have, of course, all of the logs and the case notes you need to take when you're meeting with patients. But there's something in your life as a healthcare professional that you have where you are tracking all of the information you have to synthesize on a daily basis. And quite frankly, it becomes, especially when we think about stress and burnout, it becomes very overwhelming. And it also, a lot of times in healthcare professionals in particular, it makes us feel that we are overperforming by the amount of tasks we're doing, but we're feeling undervalued or underappreciated even amidst the high level of work we're doing. And that has a direct correlation with burnout in the workforce. So for example, let's say I wake up, I'm early to work, there's 10 things on my to-do list for this specific day. I can get through realistically, because of demands, I can probably get through 5 of those things. So that means the 5 things that I didn't get through carry through to the next day. So, maybe I have 10 more things for the following day, and now I have to add 5 more things. Well, those 5 things that I actually got through, I don't even have time necessarily to track the progress that I'm making on certain client interactions or client health journeys or personal projects that I'm doing at work. I can't always, we as healthcare professionals can't always track those because our to-do list becomes so long. And it becomes really difficult to actually be able to distinguish and prioritize what is the most important things on our to-do list because, again, quite frankly, they get so long and overwhelming. Another factor that we as healthcare professionals are navigating today is emotional overload. And what this means is that we are constantly navigating highs and lows and everything in between that comes with being in the healthcare profession. I know for myself, and something that this is just an inherent personality trait of mine. I tend to take on the emotions of others. So when I'm working with patients or clients, for example, if I see them in a bad mood or they're upset about something, that very frankly just kind of transfers over to me, and I start to feel not exactly obviously what my patient or my clients are feeling, but I start to synthesize myself with the emotions that they're feeling. Um, in the literature, this phenomenon I'm talking about is often called secondary trauma. So it's really that, again, like the almost the taking of the pain or the heaviness that someone's feeling that you're interacting with, and actually almost not, I don't want to say owning it as your own, but feeling it as your own. Um, so as healthcare professionals, we are constantly navigating emotional overload. A lot of times this happens when we need to share bad news with our patients and our clients, or we need to have difficult conversations, or we just generally are seeing folks who are, of course, coming in to get better, but are not necessarily at the healthiest places in their lives. And when you're trying to navigate your own life, your own well-being, your own physical, mental health, and then you're taking on the emotional capacity and holding all this space for other people, it becomes really exhausting. And emotional overload, like, obviously has a mental and emotional component, but it also has a physical component too. I I think of about emotional overload in my own career, specifically through instances I've had to work closely with patients who've had significant health crises. So a number of years back, I was working alongside patients who had HIV diagnoses, and early in those diagnoses, life can be very gray. It can feel very sad. It can feel very daunting. And as a provider working with folks who are navigating those situations, it can weigh pretty heavy on you because for myself, I'm also a member of the LGBTQ community. So there's an added element of identity connection there as well. So, and specifically the folks I were working with were LGBTQ folks. So having that double layer almost of emotional connection intensified what I would say was the emotional overload I felt navigating those situations. And this one I'm sure we can all relate to, another factor that we're seeing present today in healthcare professionals is having this feeling of a lack of autonomy. And a lot of this comes from the reality that the healthcare profession We, as a profession, we are science-based, we are research-based, we are very procedural, we are very process-oriented, and this is 99.9% of the time a really good thing, because a lot of these systems and processes are in place because they work to the benefit of our patients and they keep things safe, they keep things working smoothly. However, we're also existing in a reality where even though these processes and these procedures exist, we're dealing with external environmental factors that directly impact how effective they can be. So, for example, within the work unit, you might feel, and I do at times, like you have a lack of autonomy in your ability to make decisions based on the protocols that exist. And a lot of times we find ourselves as healthcare professionals because a lot of us got into this profession because we really believe in making a difference in the world. And we're trying so hard to make our patients and our clients' lives better, that we'll see processes or we'll see protocols and we'll say to ourselves, I can see how this is not working to the best of its ability, and I can see how it could be better. But unfortunately, a lot of times based on the level that we're at as employees, or the specific work environment that we're in, or the organizational climate as a whole, there's compounding factors that actually make or lessen our ability or even our self-esteem to speak up to address the lack of autonomy we have in certain situations. And this can be really heavy on, really heavy on us as healthcare professionals, because again, we're oriented towards being helpful and to making things smooth and as best as they can possibly be for our patients. So when we see systems that we can't fix, it can be very distressing for us. The next one and the final one that I'm going to talk about in terms of factors and trends we're seeing related to stress and burnout relates to fatigue. And at the end of the day, fatigue is really about having to navigate such high intensity environments such as the healthcare profession, where there is little to no margin of error. There's not opportunities to make mistakes often safely in healthcare. So we really need to be at the top of our game. And working in such a high stress environment, that takes a toll on us, healthcare professionals who are also feeling like, we need to be champions to our patients. But working in that environment, having heavy workloads, having emotional overload, having a lack of a work-life balance, all of these things compounded together kind of make us feel like the consistency and the intensity of our work just slowly wears us down, where we become more accustomed to actually existing in spaces of being fatigued, and that becomes a norm for us. So a lot of times fatigue shows up for folks, especially in the healthcare profession, in the form of sleep issues. So we know that healthcare professionals have really interesting schedules. Some of us are working for many hours in a row, and then we're off for many hours in a row, or some of us are working very early in the day or very late in the day. And these irregular work schedules actually, in some ways, can make fatigue feel more normalized to us, because we actually we lose our ability to differentiate how it feels to not be fatigued, because we become accustomed to feeling sluggish or slow, or like we don't have enough energy. So now that we have gone through the common factors that are influencing us as healthcare professionals in terms of stress and burnout, I want to pivot a little bit and talk about well-being. As we're doing this, I'm just going to ask all of you, and you can do this as I am continuing in this presentation, but I just want you to take a moment and think about, of those top 5 factors that we just reviewed together, what are the ones that are most pertinent in your existence right now? So basically, if you had to pick one of them, which one is the one that is like your number one stressor right now? I just want you to think about that, and we're going to come back to it. But again, think about whether it be fatigue, work-life balance, having emotional overload or a lack of autonomy. The different things that we just talked about, perhaps think about the one that is the top stressor for you at this moment. So moving into our examples of strategies to mitigate burnout and stress, the first we're going to talk about is taking breaks. And taking breaks actually is something that is, I'm smiling and almost laughing because it sounds so like, yes, duh, we should be taking breaks. But I was recently reading, and I didn't include this in this presentation, but I can certainly share the link with you all. I was reading this study that was taking place of a group of employees who actually were asked about their break-taking habits, which is such an interesting topic. But they found that this group population of employees had they struggled with feeling that they were processing meaningful work, and that the work they were doing was making a difference. And it turned out that that actually had more to do with the fact that they were working so much, or they were working so many extra hours, that they didn't feel like they could actually appreciate the work they were doing. But this group was also asked to look at their break-taking habits, and they found that the employees who were in the study actually said that they felt like they had enough breaks, they were taking enough breaks. But when you looked at anecdotally how much breaks they were taking during their normal daily shifts, it was staggeringly low. It was like literally like less than a minute a day. And for people who are thinking to themselves, like, first of all, this group was working more than average, so like more than the average amount of a full-time employee. And they were also feeling like they weren't doing enough. So you have those two things coupled together. And then you also have the reality that they thought they were getting enough breaks or kind of times for themselves during the day. But when you looked at the group as a whole, it was less than 60 seconds a day. So the important takeaway from this study really is that if you think you're taking enough breaks, like if you think that you're being mindful enough to take breaks during the day, I would really consider you to actually start documenting the breaks that you're doing, because it might be a lot less and they might be a lot fewer than you actually realize. And breaks can take different forms. You can take a 60-second mindful minute like we did at the beginning of this conversation, or you can take a longer 15-minute break where you have time to perhaps drink some coffee or juice, or something that helps settle you down, or kind of helps with your energy. You can mindfully eat a snack, and mindful eating, as I'm sure some of you are familiar with, is a habit of actually thinking about the bite that you're taking each time you have a snack, for example. So it's kind of actually sitting with the food you're eating. And that's an incredibly helpful practice, but it's also something that helps you tune in to the moment you're in. And it's one thing to take a break and do task during your break. So like let's say I'm gonna take a 15-minute break, and I'm going to spend that time kind of like organizing files. Well, that's not actually a break, because my mind's still on. I'm still thinking about work because I'm doing a work-related task. But like a true break is when we actually take a step outside. We take a step back from our immediate environment. And breaks can be very hard to make regular in our schedules, especially because our schedules can be so all over the place. But again, I think the biggest strategy, the biggest technique here to make sure you're taking breaks is actually noting them. So you can use a journal to note how many breaks you're taking during the day. If you do that for a week, and then just look at the end of the week, like, maybe on Monday, you took a 5-minute break in total. On Tuesday, you took a 10-minute break. On Wednesday, you took a a 1 minute break. Just looking at those different numbers throughout the week, you can kind of start to see trends actually. If and in certain environments might be less conducive for breaks. So that's one practice that is highly recommended. Another is to establish boundaries. We started off this presentation talking about the concept of work-life balance or imbalance. And one of the biggest factors that it plays into the reality that we struggle with the work-life balance is that we don't set clear boundaries for ourselves as human beings. I was talking about how work and life have become so enmeshed in our society that when we think about personal time, so time away from work, more than likely, and you might not even realize it all the time, but you're still connected to work in a lot of ways. So how this shows up for me personally is that I typically access my work email on my phone, my cell phone. And what this means is that on a Saturday at maybe 6 p.m. when I'm having dinner with my spouse, my phone might vibrate and it might be a work email. Even if I just look at that for like 5 seconds and then turn off my phone, I can't help but that my brain is automatically going to start thinking about work, or at least reintroduce the topic of work into my head. So I might only think about it for 10 seconds when I look at my phone during dinner, but later on at midnight when I'm trying to fall asleep, I might be thinking about work because I'm, reflecting on my day, and I might think back to that moment I looked at the subject line of that email. I also, it's really important to name in this specific moment that like we are all humans. So the purpose of this specific strategy is not to make us feel like our practices right now are bad, or the ways that you're connecting with work or your personal life they're like inherently it's not bad, but there are ways if you're feeling burnt out and stressed, which again, I think a lot of us are, especially if we're attending this conversation today. There are little things that we can do in our daily lives to help navigate these situations. So for the example I just gave for myself, like with my phone, one thing I have done is over the weekends, I turn off my work email. So those notifications no longer come through when I'm having dinner with my spouse. And my spouse is quite happy about that. I'm happy about that. But it also, it's just good for my own mental health, my well-being. To disclose to you all, I've navigate mental health issues. I've sought counseling and medication for my mental health over my career. And I know one of those things that really kind of spurs heightened anxiety in myself, for example, is when I'm getting over enmeshed with work. So when that work-life balance line becomes, the line becomes unclear, that's typically associated in myself with higher levels of anxiety. And like it has taken me many a professional day, hour, minute, and years to understand that and navigate that reality. But all that being said, like there's a lot of stress, there's a lot of realities that we fall into as healthcare providers too that actually set us back. And related to that, it's important to set up connections with folks who can help hold us accountable. So again, one more plug for my amazing spouse. They help remind me that if it is, Friday after hours, I'm off my shift, to make sure that I'm turning on to silence my work emails on my phone, because that helps me to take space away. Another thing that we can do, and this is going to look different for everyone, and I'll talk about what my techniques are, but is incorporate stress management techniques into our life. So for me, stress management happens both on the job and off the job. So a lot of times my 10-minute breaks during the day, I will spend to the best of my ability, and it's difficult, but I will try to spend that time doing mindful meditations, So whether that's sitting in silence, like we did at the beginning of this presentation, or it is reflecting on a poem, or it is taking a quick listen to a meditation podcast. Like there's really quick little things that I try to implement during the day, and I don't do it every day. It's important to note this isn't like, something that I'm perfect at, because I don't think many people are perfect at or are perfect at this, but I try to incorporate those things into my day-to-day life. And then outside of work, I also am very mindful about my ability to kind of sit and make space for myself. So probably the biggest thing that I do, and I do this every morning, and it's not always the easiest thing to do, because some days I'm just like, this is the last thing I want to be doing. But I wake up, and the first thing I do before I eat, before I have coffee, really before I do anything, is I sit down and I pull a tarot card for myself. And this is a practice that I've done for many years. For me, tarot is it's a great tool that I use. I really do use it as a tool to kind of check in with myself. But I know people who do very different things to act, or similar to what I do with my tarot card. So a lot of times folks will wake up and they'll pray for 5 to 10 minutes every morning. And I know people who will reflect on the gratitudes they have. So thinking about their families, their friends, their health. This practice, I would say, is incredibly valuable to me, not only personally, but also professionally, because what it does for me, I have found, is taking those 5 to 10 minutes each morning. It really allows me to just kind of center myself in the day ahead. Usually what I'll do is think about, I'll kind of just mentally through my head run through the day really quick, see what's up in terms of who I'm interacting with, what meetings, what interactions, what different expectations I have for that day forthcoming. And I'll just briefly think through it. And in doing that, it actually kind of gives me the strength to head into the day, I would say, with a little more conviction and a little less stress. Another strategy, and this one I actually saw quite prominently in recent studies for healthcare professionals in particular, is the importance of support seeking to help you navigate burnout and stress. So for healthcare professionals, a lot of times we feel isolated in our professional careers, because our first and foremost for us often is the patient, which is, again, one of those characteristics of us as healthcare professionals. We're so drawn to making people's lives better that it sometimes actually becomes so consuming that we feel isolated, because we're giving our all to others. So again, we don't always have that the support we need to give to ourselves. And one way we can hold ourselves accountable to this and benefit ourselves as well in the process is by building and sustaining professional, personal, and familial networks. So in my own life, I have found that my work colleagues, my friends, my family are some of the most important people to helping me feel grounded and frankly, like I am a truly contributing human being in this world. Because without them, I wouldn't actually probably reflect on my accomplishments that much, or the ways that I know that I have helped folks throughout, or patients or clients throughout their lives. Because for us as healthcare professionals, a lot of times, like we're not doing this job to get pats on our back or accolades, but we're doing it because, again, we believe it is the right thing to do. But having family members and friends and colleagues who applaud you and who value you and who see you for who you are and celebrate you is such a valuable thing to help with your self-esteem and also help you reduce stress and burnout in your professional careers. I know for myself, I I really value the friendships I make with my colleagues at work. There's budding research, which I think is actually so fascinating because I actually never really thought about this during my professional career. I always kind of viewed colleagues as, I think, people that you interact with while you're at work, and then when you leave work, and those relationships are kind of dependent on the workplace. But we're seeing in research that there's a really powerful value in establishing good, strong relationships with your coworkers because it can be so life-giving to you. I know many of you can relate to this. It can be difficult to talk about work with family and friends because a lot of times they'll have like no idea what you're talking about, or they can't sympathize or empathize with your stories because they're so unique in the healthcare profession. But your colleagues who are literally often in those same exact situations as you can not just understand what you're saying, but they can actually go a step farther and offer you consolation or advice or strategies to deal with situations because they're quite literally experiencing the same things themselves. And because of that powerful relationship, it's actually so beneficial to have those folks around you to help build that support system when you are feeling high levels of burnout or stress. The final strategy example that I'll share with you all is the importance in investing in yourself. So when we think about the process of taking care of ourselves, a lot of times we'll say, it's totally physical. Like if I'm taking care of myself, it means I'm exercising, I'm eating right, I'm doing all those things. But I would also encourage you to think about the importance of cultivating and supporting your own mental and emotional well-being and your own sense of belonging in the spaces you're in, because these are so intertwined to your physical being. For example, when you're not feeling well, maybe you're experiencing some level of pain in your body, you're going to go to the doctor most likely and get that checked out. The same should be true for our mental and our emotional well-being because just like our arm or our leg, our brain, our mind is an organ in our body, and it needs to be taken care of. And if there's one message that has come up prominently through this presentation, it's the importance of knowing as healthcare professionals that we're often on the front lines of really difficult situations, often emotional situations with patients who we come to care deeply about, who are experiencing distressing situations. And again, we as healthcare professionals carry a lot of that weight. We also have to be, as we've talked about, on our A game all the time because the margin for error is so small in our profession. So in that reality, we need to make sure that we're taking the steps necessary to take care of ourselves. And I'll kind of finish this thought with one example of how I've been doing this for myself very recently. It's a new practice, but I've really been enjoying it, and it's something that I haven't ever done before. So I started taking walks, and I remember when I was much younger, I would think to myself, like, I remember hearing, again, when I was much younger, my grandmother would be like, "Oh, I went for a walk today." And I would think to myself, like, that's such an interesting use of your time because, like, does that like benefit you physically? And the reality is what I've learned, and now what I'm like slowly experiencing over the last few months, is that walking is such a powerful tool for the entirety of our beings. It's good for our heart health, for our mental health. So we're getting the physical and the mental. And it's in my mind, at least, it's kind of low stakes. So I'm not too worried about hurting myself because when I'm walking, I'm not necessarily I'm not speed walking, I'm not running, obviously, but it's kind of low stakes because I don't feel like I'm overexerting myself, but I'm still getting the benefits of moving my body, and I'm getting the benefits of being able to kind of rest my mind, so to speak. So walking might not be for you, but I would encourage you to think about something in your life where there's an opportunity to maybe explore what practices or what little techniques can you do to implement in your life that might be beneficial to your overall health. Um, One last thing I want to say on this is that whatever practice this might be, it's very important to give yourself a lot of grace when you're implementing any new practice. So I share with you all, I do my little meditations every day in the morning, where I sit and kind of process a card I pull. That's not been a practice that I have steadily or done over and over in my life. It's been something that I've actually had to be very patient with myself and getting better at, because it can be very challenging to do stuff so consistently and with so much thoughtfulness. So whether it's walking or meditating or mindful eating, whatever practice you think, or taking breaks, whatever practice you think would be beneficial for yourself, I just really want to encourage you all to think about the concept of giving yourself grace and going into these new routines or these new practices slowly, because a lot of times it will take a few efforts to get it right. So this concludes the formal part of my presentation. I would love if folks are interested in sharing questions. Otherwise, I have my email address on here as well. So you can definitely feel free to reach out to me, and I would love to connect and again, share some of the resources or the research that I'm either engaging in or I'm deep in the readings of, because this is such an important topic and something that as healthcare professionals, we need to be really attuned to. So thank you all, and it's been an honor and a privilege to be with you all today.
Thank you so much for guiding us through those helpful tips, Dr. Decker-Tonnesen. We do have a question or two.
Okay.
So if we can go through those right now, that would be great. So I'll start with this one. It says, do you have a favorite mindfulness app that you use to help with stress and burnout?
Oh yeah, that's a good question. I personally, this is going to sound kind of funny, but I I haven't been as good at using my phone which is ironic because it's such a valuable tool, but to engage with things such as like meditation or other self-care practices. But I know if you go on like the Google store or the Apple store or any of those stores that are on our phones, like there are so many apps for meditation that you can find. Yeah, I'm pretty old school. Like I have a pretty robust library of books that I fall back on. I usually use those, but I know for us, as you know, we're moving and we're shaking all the time as healthcare professionals. So I would just encourage you to take a look at those apps and see what your interests are and type it in and see what comes up.
Okay, great. And then another question that came was, what helps you keep stress low, or what's a daily tip that you have?
Yeah, I for myself, like my just in a spirit of transparency, my stress levels or I would say on a daily basis go up and down pretty substantially. I do notice in myself that when my blood sugar is low, I tend to feel more stressed or more anxious. So for me, like during the day, having like consistent and they're small. I do love to eat, but I do try to be mindful of like how big of a snack I have. But I try to have little snacks a lot during the day because it just helps me kind of regulate. It's also like you know, and when you're so busy with work, it's a nice little technique you can use to kind of you know, just check in and regulate with yourself. So that's probably the biggest one that comes to mind for me personally.
Okay. And another question is, when you're dealing, you talked about dealing with stressful situations and particularly patients. When you're dealing with a patient with a difficult diagnosis, how do you keep your emotions intact to support them?
Yeah, that's really I feel like it's such a good question because there's not a one right answer. I think
Right.
for all of us, it's going to look a little different. I'll just share for myself. Again, I had mentioned in this presentation, I had worked with clients. This was back when I was a case manager who had HIV diagnoses, and walking with people in the early stages of finding out about that diagnosis were it was a lot to navigate. So I I think for myself, like one of the unexpected beautiful things about those heavy times was feeling the presence of community. So again, as I mentioned, I'm a member of the LGBTQ community, and I think the benefit for me in that space was while I was working with LGBTQ people, I also felt like a natural kindredness to them because of our shared experiences. And
Right.
I think for healthcare professionals, you know, folks of color who are working with patients of color who might be more susceptible to some diseases or otherwise, like there's that level of shared identity that's really important to connect with, I would say, and leaning on the support you find in your different identities and those communities that you connect to can be very valuable.
It's really helpful. Thank you so much. Well, that concludes our questions. Unless there's more from the audience, I think we appreciate you. I mean, this has been really, really helpful. It's been great to have you back again. And yeah, is there anything that you'd want to leave us with? Any last minute words of advice?
Well, first, I would just say thank you to Robin and your incredible team and Ingenovis Health and like all the incredible work that's going on because I think opportunities like this are so valuable and taking advantage of them can be difficult. But I think it's so valuable when we engage in resources like this. So again, I would say my biggest takeaway, and this is something I tell myself every day, is take it slow, like take it one day at a time, one step at a time, and make sure that you're seeking care when you need it. It's really difficult to take that to make that call or take that first step when you need to get care for yourself, especially mental, emotional care, but it
Right.
goes a long way. So that would be my last bit of advice.
Thank you so much. We really appreciate that. And so Dr. Decker-Tonnesen has shared his email address, but if you feel free to contact us at act@ingenovishealth.com. We'd be more than happy to field some of those questions and share those and get those to you, Dr. Decker-Tonnesen. Thanks again for being here, and good night. Until next time.
Thank you so much. Have a good day, everyone.
Thanks so much. Bye-bye.
Bye bye.